Advance Medical Directives. Introduction. Mark has lung cancer in an advanced stage. He is at a healthcare facility and a respirator is helping him breathe. Without the respirator, Mark would die in only a few hours. Healthcare providers agree that Mark is terminally ill and will die within 2 to 10 weeks. Mark is conscious and can communicate with his healthcare providers. Can Mark request that his healthcare providers take him off the respirator? Choose one of the following options. 1. Yes, because Mark has the right to refuse treatment. 2. No, because Mark will die if the respirator is removed. Correct. Mark can request to have the respirator removed. It is his right as a patient to refuse treatment. Jane had a massive stroke. After days of examining her, healthcare providers confirm she has severe brain damage and there is no hope for recovery. She cannot think, talk, feel, or voluntarily move. Healthcare providers say that she does not experience feelings or joy. However, Jane will stay alive if she is fed through a special tube that goes to her stomach through her mouth. Has Jane lost the ability to communicate her wishes to her healthcare providers? Select yes or no. Correct. Jane is in a vegetative state and has no ability to communicate her wishes. A neurologist, a specialist in brain function, is usually the kind of healthcare provider who decides whether a patient is able to communicate. Jane has severe brain damage. She is in a vegetative state and healthcare providers keep her alive with a feeding tube. Jane does not have a living will. Jane's husband presents a legal document showing that Jane has given him a durable power of attorney for healthcare to make medical decisions for her if she is unable to make them. If Jane's husband asks the healthcare providers to remove the feeding tube, would the healthcare providers honor such a request? Select yes or no. Correct. A durable power of attorney for healthcare is legal. The patient writes it ahead of time to assign medical decision-making to a person he or she trusts. Joanna is a 92-year-old female who is terminally ill. At the healthcare facility, she tells her healthcare provider, "If I have breathing or heart problems, I do not want to be put on a ventilator." Can verbal instructions be considered advance directives by healthcare providers even if Joanna has no written living will? Select yes or no. Correct. In many states, oral or verbal advance directives are accepted as living wills. The healthcare provider should document this in the medical record. Richard has an advanced stage of prostate cancer and his healthcare providers say he only has a few weeks to live. His severe pain cannot be completely managed with medications. He has considered requesting a lethal pill to end his suffering, but this is illegal in his state and is against his religious beliefs. While at the healthcare facility, Richard suffers a heart attack. He does not have a living will or specific instructions not to resuscitate him. Will the healthcare providers try to resuscitate his heart and breathing? Select yes or no. Correct. Without advance directives instructing healthcare providers not to resuscitate Richard, healthcare providers will try to resuscitate him. Gina is a 22-year-old college student. She had a car accident, and 2 healthcare providers have confirmed she is in an irreversible permanent coma. She does not have a living will. Her parents are her next of kin and decide to keep her alive on life-sustaining equipment, hoping that future medical research can save her. Do healthcare providers agree that Gina can recover? Select yes or no. Correct. When healthcare providers determine that a person is in a permanent coma or vegetative state, it is their belief to a reasonable degree of certainty that there can be no recovery. Your healthcare provider or healthcare facility will honor any treatment you demand in your living will. Select true or false. Correct. Your healthcare providers are not obligated to provide treatments that are not indicated or are illegal. If you specify a treatment you do not want to receive in your living will, all healthcare providers are legally obligated to follow your wishes. Select true or false. Correct. Most healthcare providers want to respect your wishes. However, some may refuse to honor certain wishes expressed in your advance directives if they conflict with the healthcare provider's beliefs and values. In some states, such refusal is legal. Gene fell off the horse he was riding. He broke his neck and is paralyzed from the neck down. He can speak and chew, but he cannot move his arms, legs, or any body parts below the neck. Gene has a signed legal durable power of attorney for healthcare document where he has designated his best friend Andrew as his healthcare agent. Will the healthcare providers allow Andrew to make healthcare decisions on behalf of Gene? Select yes or no. Correct. Gene can still make and communicate his decisions. There is no need to rely on advance directives. Tom had a massive stroke. He cannot make decisions or communicate. He does not have advance directives. Whom will the healthcare providers ask to make decisions about Tom's healthcare treatment options? Choose one of the following options. 1. His wife. 2. His adult daughter. 3. His close sister. Correct. In most states, there is a default surrogate healthcare decision maker when there is no advance directive. This means a family member becomes the decision maker for the patient who cannot make decisions and communicate. In most states, the spouse has first priority. If no spouse exists, adult children come next. Which of the following advance directive documents applies to end-of-life situations? Choose one of the following options. 1. Living will. 2. Power of attorney for healthcare. Correct. The living will applies mostly to end-of-life situations. Robert has a living will and a durable power of attorney for healthcare where he appointed his brother John as his agent. Robert is hospitalized for a mild heart attack. While at the healthcare facility, he decides to withdraw the durable power of attorney for healthcare. How can Robert indicate his decision to cancel his advance directive to his healthcare providers? Choose one of the following options. 1. It is acceptable only in writing. 2. It is acceptable in writing or verbally. Correct. Robert can revoke his advance directives verbally or in writing. Thank you for using Explain.